a planning for revision right from the beginning is extremely crucial. Randomly हाँ एक round of reading हो गया, randomly बैठ के कुछ पन्ने इधर उधर कर लिया और revision हो गया, that does not work. So have a plan well in hand from the day you begin preparing for medicine, right? Hello everyone, welcome to Physics Wala Meded. I am your faculty for medicine and I am called Dr. Santosh Patil. Well, in this next 5 or 6 minutes, I will help you to devise a plan for your revision of the subject called medicine, a mammoth subject, in your final prof preparation. Now you may be thinking, sir, इतनी जल्दी भी क्या है revision के लिए, because अभी तो 1.5 years or 18 months का time है for us to face the final prof exam. पहले ये बताओ, how should I prepare for the first reading? उसके बाद में we will think about revision. Well, उसके लिए हमने एक अलग सा वीडियो बनाया है where we have discussed how to prepare the subject of medicine, but even a planning for revision right from the beginning is extremely crucial. Randomly हाँ एक round of reading हो गया, randomly बैठ के कुछ पन्ने इधर उधर कर लिया और revision हो गया, that does not work. So have a plan well in hand from the day you begin preparing for medicine, right? So let us say that your final prof is going to be of 18 months. So in that case, let us divide that 18 months into two blocks of 12 months and 6 months. So in this 12 months, I want you to give the first reading of medicine along with other subjects. Okay, but your revision should start here itself. So when you're doing the first reading, I want you to complete all the MCQ modules of whatever systems or chapters you are completing. Now, I count solving MCQs as a revision. Why? Because MCQs help us to get the objective understanding of whatever subjective stuff we read, right? Like, just to give you an example, I read about heart failure, I read about we use AC inhibitors, ARBs, beta blockers, but when I start looking at the MCQs, I understand why a particular drug is useful in a patient with heart failure. I try to remember those points better. Okay, and that makes your answer writing also more objective. Just instead of mentioning the list of drugs used for heart failure, now you start writing sentences which make sense to the examiner. So that is your first round of revision, which is running parallel to your first round of reading. Once you're done with that, we are getting into the revision mode. That is the last 6 months. Here also, I would divide that revision period into blocks of 2 months each. The first 2 months, the second 2 months, and the last 2 months. So in the first 2 months, what I would suggest, just revise the notes. These notes may be pre-printed notes or your own handmade notes, whatever you are following, right? Or if you have attended the live lectures, it is the teacher's annotated notes, whatever is your source, revise them. Give one thorough reading. After that, the next 2 months, I want you to spend writing answers to the previous year university questions. So we will call this as the answer writing phase. Now you may be thinking, why is this important, sir? Instead, I can read one more time. Remember, you may have understood everything about a topic and you may be able to answer the MCQs. MCQ nikal rahe honge, you may be scoring well. But when you sit in an examination hall and try to write जो flow of thoughts हैं, you may not be able to channelize well on a piece of paper. But prof exam के लिए तो writing is more important, right? Not solving MCQs. So you have to practice writing answers. To take out the university papers, start writing answers without looking into your notes or books. So when you do that, you realize कि मेरे understanding में lacunae हैं, right? For example, I'm writing about Cushing syndrome. I come to diagnosis. And when I come to diagnosis, I'm not able to create a flow chart for the diagnostic algorithm or steps. In that case, revisit your notes, get it corrected. So now you have understood it better, you will remember it better, you will recreate it better in your examination hall, and then nobody is going to stop you from scoring those distinction marks. Okay. After that, the last 2 months. The last 2 months focus on your weaker or volatile areas. Weaker or volatile areas. So what are these weaker or volatile areas? They are subjective, right? For example, I struggle to remember tables from Harrison. So in that case, I will try to revise the Harrison's tables. If you struggle to revise the flowcharts or algorithms, you can try to revise. So anything that you find you are weak, you can revise in the last 2 months, and then you should be ready to face your final prof exam. And remember, whatever effort you're putting here, this is not going to go waste soon after your final prof exam is over. This legacy will continue to reflect on during your internship, and it will definitely help you to prepare for your NEET PG better. Internship means you start applying whatever you have studied in the final prof, and that application reinforces your memory, and that application skill will also help you to apply the same concepts or knowledge to MCQs. The net result is a good plan of final prof preparation will definitely help you to ace your final prof, internship, as well as NEET PG, right? So begin well so that you end it well. That's it for me today. Thank you.